session, we are going to get started with a panel discussion, and this panel discussion is specifically related to the healthcare sector. Yes, that's right. We're going to be talking about voice technology in healthcare. Just some of the topics that we're going to be talking about are how the pandemic, that's the coronavirus pandemic, is reshaping healthcare with regards to speech recognition. We're also going to look at what is the future of voice tech in the long run, how exactly voice technology is going to help make things easier for hospitals and hospital assistants. And of course, are there any obstacles, drawbacks, or challenges to this technology, or is it all just like manna from heaven? Right, so our panelists are Ms. Kamales Lardi, who is the CEO of Lardi and Partner Consulting. We also have Mr. Abdullah Saleem, who is the Group Chief Information Officer at Omni Hospitals. We also have Dr. Mazin Gadi. If you could just raise your hand for the benefit of our audience, Dr. Mazin, who is the Digital Health and Innovation Director at IQVIA. We also have Iyad Abou Shabib, who is the Chief of Medical Informatics of the Saudi German Hospital. And we have Dr. Osama, who is the CEO of Tachy Health. Right, everybody, thank you very much for being a part of the panel discussion. This is the post-lunch session, which tends to be a very challenging session, but we're going to try and make it interesting for our viewers from across the globe. Right, so if I can start with you, Ms. Kamales Lardi. I was going through the website of Lardi and Partner, and you are a digital transformation specialist. So perhaps could you explain for the benefit of our audience, what is your area of expertise with regards to digital transformation, and how do you integrate that with voice technology?
Good afternoon, everyone, and thank you for having me. It's a pleasure to be here today. So my expertise, I've had about 20 years of experience in the space of digital and business transformation advisory, and I used to actually work for Deloitte Switzerland. I was the head of Deloitte Digital until about and after that, I started my own consulting company. We are an award-winning consultancy in Europe, in Switzerland. And we focus on helping companies understand new tech capabilities and how you can apply that within organizations for engaging with customers, for optimizing your operations and operations, as well as digitizing products and services and creating new business models and revenue platforms, basically. And so we've consulted or advised companies across various industries in Europe and Asia, including companies like UBS and Pfizer, Victorinox, Ernst & Young, and multiple other organizations. So we work mostly with larger organizations. And within voice tech, I think that's one of the key elements for digital transformation. As we moved away and you saw the trends that we've seen within interaction points or activation points with technology, we went from keyboards and typing into low touch, so into interactions with touch screen. And now we're heading into an environment where low touch or zero touch user interaction is the next stage of transformation. And we're seeing adoption of this particularly accelerated by the coronavirus pandemic, where low touch has become a key element of interaction across industries. We're seeing voice technology really accelerate, and the coronavirus pandemic has really become a catalyst for voice tech. And we're seeing the applications across many, many industries. And this is one area that we work on. We specialize in helping companies understand these engagement points and these digital and physical touch points to their target audiences, whether it's customers or even B2B environments, and how you can utilize voice technology to enable these interactions.
If I can just interrupt the panelists, I'm so sorry, I forgot to introduce our moderator. I totally slipped. Ella Duda, who's the International Strategy Director at Sixième. Ella, please take it away. I'm sure you already have done the introduction. The stage is all yours.
No problem. Thank you. So yes, my name is Ella. I'm the International Strategy Director at Sixième. Thank you so much, and to all the panelists for letting me to moderate the session. That is incredible. There's so much information that we're going to learn. So Kamales, I'm going to start with you and your question, even though you gave a quick introduction. What is the value proposition for voice tech application in healthcare?
Thank you, Ella. I did go a little bit into how the application is developed, and I think within healthcare specifically, the value proposition exists within two main categories or two main areas. firstly around recipient engagement. So this could involve people who receive healthcare provisions, right? Receive healthcare services, and this really looks at enhancing access points to healthcare. We've seen some really big advancements in terms of voice technology enabling additional healthcare. And this is very relevant for markets like in the Middle East, where population is very tech savvy and digitally mature. The access points to healthcare could involve enabling biometric devices or enabling emotion sensing on your wearable devices to allow people to engage with healthcare providers in new ways. And I think this is something that's extremely relevant because the communities or the recipient of healthcare that you're working with, they want to look for services that are personalized, hyper-personalized even, predictive and preventative, as well as participatory. They want to be involved in their healthcare. They want to be involved in terms of understanding the health services that they're receiving, as well as the type of options available to them and the type of services that they can receive, the type of medications as well. And so these create a certain additional access point, particularly within this low touch environment where you want to engage with your healthcare providers, but you don't need to actually physically be engaging with them. So a great example of this is Amazon's creating, they have Amazon Alexa, which is quite popular, but Amazon's creating an upcoming service called Dylan, which is really focused on healthcare services. And it has emotion sensing technology for voice recognition, which really looks at listening to your voice and changes in voice patterns and intonation to know if someone is not feeling well. And we've seen this type of technologies being applied to diagnosis for Parkinson's, as well as even anxiety and depression. So that's growing. Another element really is around patient engagement. So when you want to have further engagement with people within your healthcare facilities, an example of this that we've seen quite popular in Europe is for patients who are in hospital beds, who are in the institutions, and they have additional questions and they want to gain access to more information. So the voice-activated technology next to their bedside could provide them this information rather than having to speak to staff all the time. And so they can consume this information at their own pace, and it really increases the level of engagement and interaction, as well as the satisfaction level. On the other side, you have then value propositions for the healthcare providers. And here it focuses really around the productivity level and efficiencies. One example of that is really for doctors and nurses to have voice-enabled patient recording, patient information recording. And this creates a more robust medical record for the patient, as well as it allows zero-touch environments that doctors can actually record their information on. And the market has some amazing examples like Suki.ai and Sekara that are very well adopted in other regions. And this could be, a platform that we could look at, particularly within the region that we're talking about in the Middle East. Another one that's quite popular here in Europe is healthcare facilities that allow for voice-activated touch points or engagement. So what I've seen is elevators, for example, in hospitals that are voice activated. So patients, visitors, as well as providers, staff working in the hospitals don't have to touch the buttons, and they can with voice activation, move from one spot to another. So all of this is really, I think the potential is really there. The value proposition for the market is undeniable. The challenges, obviously, particularly in the Middle Eastern market, is around language capabilities. And here looking at English language voice recognition, as well as Latin-based languages like German and French, we've seen huge advancements. But in other types of languages, there's still, I think we're at the nascent stage where it's still there's still potential to develop. And here in Switzerland, we have a similar challenge as in the Middle East with the Arabic language, for example. So here we have a language called Swiss German, which is quite, it's the language of the country which most people speak, but it's not a written language. And so creating voice-activated solutions or natural language processing for Swiss German is actually quite challenging. And so with any of these areas of solutions, we need to still build up the data sets around how these the words and the context and the language can be basically utilized within these technology solutions. So I believe that the focus should really be around verticals. And here we've seen the biggest success areas really focusing on specific parts of the industry and deep diving in terms of creating the language solutions for that. Thank you. I'll hand over now, Ella.
Thank you. I was looking for the demute button. Thank you, Kamales. That is really insightful. And I know living here in France, I've seen a few improvements myself, but the possibilities are just really incredible to organize this better in such a very important part of our lives, knowing like what's going on with our healthcare and keeping track of it, which is a really big one when we're all moving around so much. So thank you. Moving on to Iyad to continue this conversation and kind of build off of what Kamales already said. If you could just give us a quick introduction of yourself, Iyad, and your question is, what is voice tech going to do for patients, healthcare providers, and healthcare facilities? And maybe you have an anecdote to tell us what you might have already experienced.
Yeah, thank you a lot. Thank you. It's also for your questions. It's a valuable questions. I am in since 12 years in healthcare facilities and in the digital transformations and the innovations. Implemented many systems from paper-based hospitals to be paperless hospitals, many hospitals. So we know and live with electronic and the impact of electronic EMR on the healthcare and deliver quality of care for the patient and the time saving for the patient. Now, related to your questions, we recognize that there is a development and growth in the voice recognition since 2011 with Apple with Series, then with Amazon, with Alexa, and end up in 2016 with Google. So now it's already the 70% from the populations, they already using telemedicine and telehealth during the pandemics, and a lot of people now, they are looking, once they're using Google, they are looking for voice search because it's more faster. So this now during, even after this pandemic, it's let us more recognizing for the implementing the voice technology in healthcare facility. Because in EMR implementations, that the doctor is giving more focus to complete the documentations and the others in the system, and the patient will be dissatisfied because the physician, he will complete the field that it's already mandatory typing, and this the typing, it's already capability typing and texting. It's different from individuals to another, so it taking consume time. The physician, he will the big worry for the physicians to complete the documentation, and he has already limited the slot. So all these area, once we will utilize the voice technology, it will decrease the time. It will give more focus between communication between the physician and the patient, and it's already for accessing, even accessing the information. If the interactive between the systems and the physician for accessing the information, searching the information, alert fatigue that already used before, it's text, the doctor, he need to read it, then so this one, it will, even now with voice technology, it will be decreased and even eliminated, because it will be patient has allergy, patient has blah, blah, blah. So it will be a voice interactions between the systems and the healthcare provider. So it will decrease and improve the patient communication, as well as once you will decrease the load of documentation, it will improve the patient satisfaction and the patient healthcare provider satisfaction, because it will decrease and the workload. Now it's already regarding the smart and safe. Before in the documentation, many systems that allowed the smart note and the template for documentation. So you find most of the documentation, it's almost typical, but just some changes because it's a matter of smart note or template. Now with the voice technology, it will be there's a unique documentations, complete documentations, no typing error, spelling, grammar, all of this, it will be more accurate. Even it will allow a multitask. Now before you need to be free for the computer just to type. No, now you can do the operation, and with the voice recognition, you can record an operation, you can do procedure, you can do the CPR at the same time, so you can order the medication. So it will can be an area for innovation and decrease the load and allow the timeline documentation at the same time of the event, the documentation. So before there is a lot of use for late entry. Why? Because you need to perform the procedure, then go back to your computer to do the documentation. You need to sterilize yourself, hand washing, then you will go to the computer documentation. Now, no, even it will decrease, even this during this pandemic, it will decrease the cross-infection because will decrease the sharing mouse, keyboard, instrument without touch. It will be immediately voice recognition. You can do your documentation. This one, the impact for it will decrease. In OBD, it will decrease the slot because it's already 45 seconds to complete the documentations because it's a voice recognition and so fast. It will decrease the slot. That means it will increase the revenue. You can utilize the voice recognition technology in the appointment, in the call center, and a lot of things. So it will decrease even the manpower and the cost effectiveness for the hospitals. Now it also will be at the end, it will land up with more productivity, high quality, timelines, more easy, and decrease the stress and the workload for the healthcare providers. Thank you. I can hand it over now.
Yes, thank you. That's excellent. So many great points. It's really no denying how beneficial this voice technology, AI technology will be for the healthcare sector. And we don't, as patients or just, as people that go to the doctor, we don't think so much about all of the administrative work that goes into what they need to do in their daily routine. And so if we can help alleviate that being such a burden, then we'll have time to actually, remember who our patients are. And especially in France, we have global healthcare. So you have more time to really care about a person, and that's so important. Thank you, Iyad. Dr. Mazin, on to you to continue the conversation. Your question is, what are the potential voice technology trends and regulation challenges that this innovation will create in the post-pandemic time? A lot of stuff there.
Absolutely. And I think, I don't know if you're able to hear me. Excellent. So basically, I think my previous colleagues and Iyad specifically pointed out a lot of the great benefits that the voice recognition and the voice-based technologies in healthcare. I'm thinking about obviously a different term as well that they've used in the literature, voice enablement healthcare innovation. And if you look at the importance of voice technology in healthcare, specifically in the post-pandemic, where everything has to be contactless, right? So there is a huge amount of potential now for patients, for providers, as well as, I believe, for other stakeholders. For example, I've been working in the digital health space for almost 20 years, like the previous colleagues, and the EMR, the electronic medical record world now, where everything is digitized in hospitals, using hospital information systems, lab information systems, and whatnot. Definitely, there is a huge ground for voice recognition and voice technology to be embedded to help the healthcare professionals eliminate human errors, eligibility of spelling and whatnot. So there's a lot of issues with that. As you know, number one biggest threat in a hospital environment to a human health is the pen. They used to say that when I was working in PwC, when we looked at strategies, digital health. So the pen is actually number one threat. The eligibility of physician writings and prescriptions, specifically when you administer drugs. But coming to the question in terms of how the regulator will react to this, and the trends are there. So voice recognition could be embedded in the patient experience to enhance the patient experience. It could be embedded to enhance the healthcare provider productivity, from documentation to compliance and whatnot. The area that I want to bring into this discussion is the regulator side. Voice technology will generate a lot of unstructured data, and this unstructured data is a huge gold mine. they're trying to actually bring in the analytics world, the big data world, to try and take this voice enabled data aggregation in healthcare is going to help us a lot, specifically as we can generate more data, the speed of data collection, the amount of waste eliminated by taking voice technology, making sure that you are able to collect a lot of information, and this information is transcribed into structured data that then later on can be analyzed is huge. So the concept of data and compliance is a very important aspect. From a regulator perspective, there is a huge acceleration in deregulating that part, allowing that part to happen. A few years ago, the concept of e-signature was a huge, big issue in the Middle East, specifically as the digitization started in 2006-07 in the UAE, Saudi Arabia, and neighboring countries. There was a huge debate about e-signature. Shall we offer the prescription with a manual signature or an e-signature? Imagine now, as deregulation happens, as post-COVID-19 comes in, there is a lot of relaxation in technology, specifically voice-related technologies, as it gets coupled with telemedicine, the concepts of AI, ML. The previous sessions this morning in this wonderful conference, they were talking about the concepts of bot, the use of AI and ML, and how you can actually use voice technology to try and drive better patient experience. Healthcare by nature is a complex industry, and I believe regulators are now getting more the hang of, obviously, relaxation of regulations to try and alleviate services, processes, to try and get a better experience for the patients, for the providers. And specifically now at this pandemic period, where you have obviously our love and blessings go to our frontliners who are fighting this pandemic. And the least thing that we can do is to enable them use these technologies to reduce the burnout as they are fighting pandemics, as we are preparing for future pandemics. These technologies are becoming essential for our front lines and heroes and heroines who are fighting on behalf of us across the world. So I think from a regulator perspective, there is definitely a lot of learning, a lot of catching up, and it's very evident that as the providers are innovating, as Iyad said, as the different vendors are embedding voice technologies in healthcare innovation, as startups are coming up with great ideas for complex scenarios, whether you're talking about diagnosing, whether you're talking about patient experience, whether you're talking about provider satisfaction when it comes to productivity. But the regulators at the moment are definitely exploring how to lessen the burden on the frontliners as we try to become more agile in the way we regulate. Voice technology has a lot of potential, and we see this across the region.
Thank you, Dr. Mazin. Again, so much information and so many important points. Saleem, you're with us. Welcome. And we'll go on to you next. If you want to give a quick introduction of who you are, and then your question is, what value proposition, because you come from a perspective where you want to invest in this technology. So what value proposition do you look for when choosing the right AI voice-driven tech? You're on mute.
All right, thanks, and my apology to being a bit of late. Since I had a different mail ID that the 4:15 is going to start with the Indian Standard Time. That's what the confusion. So apology from my side for all the audience here. The quick introduction about me. I come from the purely product background. but I took a U-turn to go and work in the healthcare hospitals to understand what is the challenges and why the technology is not being adopted by the clinicians fraternity. So I'm working in a group of Omni group of hospital, which has got 7 hospitals, and almost 10 hospitals are going to come on the mother and child care under the same umbrella. And I'm working here for the past 3 years, and I take care of the technology stack and the infrastructure stack for this organization, which is here in India and the down south side of the Indian part of the India. And I have spent a lot of time in Amman, Jordan, where the first EMR implementation was happening, and the challenges again was from the clinical side, that the complete 100% clinical documentation was not being captured, where the doctors were saying that they're not type A's first. Second, they're saying that we are losing the eye contact with the patient. No? And the second thing, they say that though the clinical documentation was made in a tick sheet base and with minimum inputs, and then evidence-based medications protocol were there, but the doctor was supposed to intervene and type at least 5 to 10% to that clinical documentation during whether it is OP or IP assessment, but they were very reluctant to use that. But here, this technology which we are talking about, the evolving technology, the voice and recognize based AI-based voice and voice technologies is going to move ahead. Then it's going to add a lot of value. And the first one which we shall talk about, that what are the important prepositions this technology is going to do. The condition is voice technology with AI-driven with clinical automations should be there for the healthcare and health informatics in the industry. So if you talk about the prepositions, it is going to give a value preposition in terms of clinical and non-clinical better data security. And then it's going to get better adoptions for EHR or EMR, which is a global issue for 100% adoption by the clinicians. And they're not adopting because the solution has not been made. It should be a faster than paper, and it does not need any training to the doctors, and they don't want to type a bit on this, and there should not be a typewriter kind of to capture the clinical data for the patient. And on top of it, they should not lose the eye contact when they are at the point of care position. So it is going to ensure that better patient engagement at point of care, and it is avoiding the clinical errors. And avoiding the clinical errors, since I don't know, means I know for India and the US, in India, and the recent study says that due to the clinical errors, almost 5 to 6 millions of people are dying due to the clinical errors across India. But of course, the other country also coming are there and facing that problem. So that clinical errors which happens knowingly, unknowingly by the clinical users, that will be stopped. And then it is going to improve the continuous patient and providers' experiences because it is towards the quality healthcare enabling within the individual reach. So this is one of the major area where the prepositions will be added, will be given added once this technology is going to come in picture. As I said in the beginning, this is in an evolving situation, in an evolving stage, and there are one of the major challenges which are talking about that if the major challenges, if I talk about the other side of this voice-based multilingual is the challenge of this voice technology, where a lot of startup and experienced companies like Epic and Cerner are coming forward to mitigate this issue to make 100% accurate. So if we'll see that the resolution and evolving, how it's evolving, if we'll talk about the current studies, is talking about that healthcare alone is taking 47%. 47%, 1% the people are working towards this new technology, AI-driven based voice technology, for where the healthcare is evolving 47%, and finance is taking this technology ahead with the 14.7%, and education is taking education and e-commerce is taking almost 14.7%. Hospitality is taking 2.9%, and agriculture sector is taking 2.9%, and finally the real estate taking almost 2.9%. If you see that the healthcare, the largest bucket where the organizations are spending right from their discovery, R&D phase to materializing the product.
Thank you. Those are really powerful. Ooh, I hear myself. Could you go on mute, Saleem? Thank you. Now it's better. Thank you. That's really interesting to know that in terms of adoption of healthcare is at the forefront. Our last question for Dr. Osama. How are consumer-based voice assistants transforming the patient experience from your perspective? Because you come from a more consultation way into this conversation.
Yes, thanks, Ella. First of all, can you hear me well, everyone?
Perfect.
Okay, great. So I'm Osama. I'm coming from a medical background where I started my career as a physician, but then I moved out to more on consulting and hospital management, let's say, side. And then I moved to the startup side of the healthcare, where we work on a company for the last 2 years called Tachy Health, where we are having a vision actually to bring fast forward the best AI tools and the state of the art AI tools to the healthcare while doing R&D. And we are based in Dubai, and also as well we have a research team across the Europe and the US as well. So yes, we are blending some of the capabilities between different countries. But for your question, actually, specifically, I think the main driver now for the voice assistance and the advances that has been happening in this space specifically are related to the consumer base, not the healthcare. So there was very early in the days, there was kind of dictation algorithms that they were, let's say, using some sort of machine learning. And then there was a breakthrough when, let's say, Apple and Google as well, they started having more advanced, let's say, natural language processing engines, like what we're seeing with Siri and Google Assistant as well. So in that space, there was more R&D coming from, let's say, consumer perspective in developing deep learning algorithms. And the breakthrough came at that point, actually. The last, let's say, 5 years, there was a research and applications now happening on a consumer perspective that made the advancement in the healthcare, where we are focusing today, way better and way more advanced. So when you talk to Siri now, it recognizes you way better than what it used to do when it started. And that's all, as maybe my colleagues said and Dr. Mazin said, yes, we start to have more data, structured and unstructured data. So now the algorithms are better trained actually to learn more. And then we're taking those, let's say, consumer-based applications to the healthcare and see how they can be adapted. In this space specifically, I think we would definitely need to mention a couple of algorithms, first of all, from natural language processing and deep learning specifically now. The latest addition to them is now the GPT-3. So, and that's an open AI algorithms that's now it's labeled as one of the deepest neural network now in terms of the language understanding, comprehension, and even talking and even understanding what you are saying to it in a very good way. That was never got to this point before. Before that, there was also Google doing some part, and they released what's called BERT, and then Facebook also they did some fine tuning to that and did something called drawbacks. So those, let's say, state of the art now are getting used within a wider spectrum. For example, in our work within Tachy Health, we adopt one of those models just to make the end user, which is medical coder in one of our systems, they can very easily type something say something and then getting it typed and researched within a very intuitive way. Also, from a consumer perspective, I have seen some hospitals within the region, they start to really think about the room actually of the patient within the hospital to be like a smart home kind of thing. So if you guys have like Alexa maybe or Google within your home devices, yes, you can open the curtain, you can actually turn the TV channel that you like, the light on and off, and those kind of things. They became part of what's happening now within the design space of the new cutting edge actually hospital across the region. I have heard that from Al Musa, Saudi German Hospital, Faqih, and many others. They are really putting the foundation now to have the patient sitting in a room and understand, yes, this is not like we're using it in the home for a fancy kind of use, but in a hospital, there is a definitely need because the mobility of the patient is not like the best actually, and we don't want to take the risk actually of the patient leaving just to turn a light off and on at night, for example. So that's I think one part that's really critical now. We have seen also other part that's getting adopted, but unfortunately it's not. There was because of the limitation in the Arabic language, and that's something maybe we need to bring actually to the table since we're focusing on the Middle East. Yes, there is a big problem in the Arabic language recognition. NLP engine that's trained on Arabic are almost minimal, and they are very weak. The data set that they have been trained on is very small compared to what we have, for example, in the English and French and the other, let's say, common language, in Chinese as well. But then so the limitation is there. However, we have seen, for example, some very good adoption, and honestly, that's maybe not in healthcare, but it's I think it's transformative. For example, Emirates MBD, which is a very famous bank in the region, they have adopted some sort of so when you call the customer center now, there will be like a very smart, honestly, voice recognition tool that can understand your request and get you in exactly what you're looking for. And I believe that those kind of technologies, especially what Google has been working on, gonna transform a lot of the patient experiences actually with the healthcare before getting to the hospital, getting just information about their care, get to know more about like conversational chatbots. And then you have also within the healthcare where you have a smarter hospitals actually. I'm talking from a patient perspective, and also I think my colleagues Iyad and Saleem were talking also from a provider perspective. Yes, you're going to have smarter way to run a hospital with minimizing actually the charting time. So it's a killer actually. I think also Dr. Mazin mentioned that it's a killer actually for a physician to set and just doing 40-50% of the time just doing typing. So there is a huge saving coming there, and not saving from a time perspective, but it's going to impact the patient and consumer also indirectly as well when we have more face time actually with the physician, and patient. So I think those are some of the key points that I want to bring from, let's say, consumer or patient perspective actually to play?
Thank you. Just so this topic is so profound. We have a little bit of time to go into the networking part since we have such a big panel, and this really deserves a whole conference for itself. So I see that we have one question, and I think it's a really good question from Prasanna. So in the last 5 minutes, if whoever wants to take it, how should businesses approach privacy in healthcare with the adoption of AI, and in healthcare businesses specifically? All right, Saleem.
So the healthcare privacy, it's very, very important in terms of across the globe, across any country. The patient data privacy is one of the important component. If any solutions are going to come down and being deployed, that the questions come across that whether it is like a HIPAA compliance, right? HIMSS has given a great guideline in terms of how the data is supposed to be put secure. You know? So in that case, the device technology is going to add a lot of value in terms of that based in the device, the EMR will be open, the particular doctor is there, and the patient who has been marked as a VIP or some secret patient of the country, and there are few people unless this without touching the object, so that the guy is there and on a kiosk inside the doctor lounge, he's just putting his name and his voice, and then he's accessing the patient data on top of it, and because it's going to give a very strong security even beyond the IT department who is controlling it. The control will be on the device, and nobody can do any alteration on top of it. So the data privacy, as far as concerned, in EMR perspective, wherever it is running, wherever I'm talking about whether it is Asian country or it's US, UK, Europe, where this device technology is going to add a lot of value in terms of securing the data at the time of accessing to provide the treatment for that patient, especially for those patients who are on the trial. Trial patient then kept there, that also those kind of data will be kept secure in terms of accessing within the organization, beyond the organization. That's what I feel in terms of the data privacy and security, how it is going to add value.
Thank you.
Ella, can I just add as well to that?
Sure.
So we have quite a lot of experience doing similar types of implementations for other industries based on GDPR. And GDPR is very similar to the HIPAA compliant rule that applies across Europe. And I think here, as Saleem mentioned, the HIMSS, they've provided very good guideline. But the focus areas for businesses trying to implement within healthcare should look at several elements. So one would be around the administration of the data itself, so how the data policies around that are created, how the data is then managed, as well as the access to the data and information relating specifically to patient medical information or patient identifying information. And so here, looking at how that information is accessed, is created, managed and deleted and stored and things like that, as well as looking at the physical aspects of data storage, so around physical security, where these access points are, and a very specific angle around cloud data management and where that information is stored, which cloud services are being used, the security elements within that. And we also then look at confidentiality of the information. You might have different layerings of confidentiality, very confidential information right down to perhaps more open information. So there might be different scales of confidentiality. And also looking at things around the technical capabilities, as Saleem mentioned as well. So the technical, like cybersecurity elements that need to be put in place. So it is a rather complex piece. I think Mazin mentioned earlier that there's a big regulatory aspect to it that needs to further be developed. But it's quite a complex area that looks at different elements within the security or the data privacy piece.
Sure. And if I may just add to that, thank you, Kamales, for queuing me in. My first advice is, number one, if the businesses want to first check on the locality, geography. So, for example, if you come to the UAE, there is the UAE ICT data law. You probably need to make sure that you take in consideration what Kamales has mentioned in terms of localizing your, the physical storage of your solution. Get to know your locality. Saudi Arabia is very advanced. They have policies from the SFDA, Saudi FDA on software as a device. You need to make sure you are familiar with those geographies and localities. GDPR and HIPAA are very great benchmarks if you can get support from those who are expert or experienced in these frameworks. I think that's fantastic. But also don't forget to localize your knowledge and understand the localities where you are trying, which market you are entering, for example. That's very important. That's 30 seconds before I hand over to Iyad and Osama to comment.
Yeah, just from my side, it's very quick then. When we talk about voice within a hospital, there will be always I think a pushback from regulators as well as from patients. So the notion that Google is always listening to me, right? So and the mic is unmuting itself, for example, sometimes. And there was honestly some let's say a media that I believe it's based on real fact that. For example, Facebook was actually using a mic without your permission to listen to what you're saying, and definitely using this data for probably advertising, right? So when you go to the hospital, you need to be always very sure also about the same will never happen. Because in a hospital setting, yes, there is a more sensitive information. So, for example, I would know that patient XYZ got this specific medication in this specific time. So, and that's the most, let's say, sensitive kind of electronic health records, actually, that you want to be very sure that it's abide by all the regulations that my colleague has mentioned. So the main idea, yes, you need to be assuring that within a hospital environment, when you say, Amazon, please help me to open my curtains, it will not listen also to the medication prescription that the physician has said, because those are totally two different, let's say, data sets. So from an implementation perspective, you need to be very cautious. When you talk about the EMR, I think by nature, it's going to be abiding by all the kind of regulations. And to mention a few is definitely the HIPAA and then the GDPR. But then the main idea is that you need to be also cautious on the implementation from consumer perspective. Yeah.
Thank you. I'm just looking at the time. Iyad, do you have anything in 20 seconds you want to add, or do you have a global agreement on this question? Oh, he keeps coming in and out for me. Okay. I'm going to say that he agrees with you. So thank you so much, everyone. We have our host back. It was really a pleasure. Thank you, everybody, for listening. Fascinating, really insightful time we had today.
Thank you so much, everyone. It was a pleasure.
Yes, that's right. Thank you so much, everyone. It was a pleasure. And as Kamales said, very insightful. And if any of our audience would like to interact or engage with any of the speakers, all of whom are available in the VIP section backstage. But until then, thank you all, ladies and gentlemen. Thank you so much for being a part of this panel discussion. Thank you.
Thank you for the invitation.
Thank you.
All right,
thank you very much. Thanks
ladies and gentlemen, our next session is how to create engaging and magical interactions with social robots. All right, we have a number of interesting participants for the panel discussion. We have Furhat, who is a social robot. A robot, that's right, you heard right. Furhat, a social robot who has come all the way from Stockholm in Sweden. I mean, come from Stockholm in the sense based in Sweden. And we also have Charlie Caper, who is a robot interaction designer at Furhat Robotics. This particular panel discussion will be moderated by Susanna Dillenbeck, who is the head of commercial partnerships at Furhat Robotics.